Must be we are all meeting after a small break. Okay? And at least the PG class, the advanced class, advanced teaching class, whatever specialty class we had planned, we started with the remedy. I don't know if you remember the remedy. First question is, do you remember the remedy? First question. And if you remember the remedy that we had started, then the other questions will come up. So what do you remember and all those things. So hopefully I will try to conclude in the next 1 hour what we have started. And I don't know if all of you had a chance to attend the class or only few of you attended, I am not very sure. But what we started, almost some 2 hours solid we have spent. Okay? And what we started was, we spoke of a remedy, a rare remedy by name Asarum. Okay? So in the first class, we had a small comparison. What are all the minor remedies which mainly acts on the nervous system. So we had a small discussion, if you remember. And in the second class, we spoke of, exclusively we spoke of mind of Asarum. Though it is a rare remedy, we almost spent 1 hour in understanding the evolution of Asarum from various books and basically from the repertory. Okay. So what is Asarum basically, or what do we know about Asarum before I go further? What do we know about Asarum?
Oversensitive to noise.
Yes, oversensitiveness to noise. This is something that we already know from our UG and from our practical experience. But last 2 classes we have tried to deviate a little and we have tried to understand Asarum at the level of PGs, okay, or at the level of clinical application. So what was Asarum that we studied? Yes, they are sensitive to what? Noise. And if you read Boric, if you read Carc, how is it given?
Crackling of paper.
Crackling of paper. For example, even if you fold that paper, no, or not folding. Folding is done in a very decent way. I am not talking of folding, crushing. When you crush the paper, you know, crushing looks a big word, but what are you crushing? You are crushing a paper. Even that sound, the crushing of paper, you know, whatever sound it is produced, Asarum is very, very sensitive. We spoke of various remedies which are sensitive to noise. We will not repeat the same thing, otherwise we will not go further. So that sensitiveness to noise was very, very characteristic. Even, what is it, the cloth, he says linen, even that scratching, okay, fine, that is again very, very sensitive. See, many of us have this bad habit of taking out our comb, no, and we make a kind of noise. And you know, many do get irritated. And who are those who get irritated are mainly Asarum patients. Even that sound of made out of the comb, that they get highly irritated. Okay. Now coming back to the evolution of Asarum, we saw how a normal family, normal child, and what happens after that normal family, normal child?
Over expectations from parents.
And how each constitution will behave when there is over expectation. And how is Asarum behaving? That's what we spoke in the last class. And they go into a state of
anxiety,
precocity,
overexertion.
They trying to exert themselves more to meet the demands or expectation of the parents in the bargain. Brain is getting overstimulated and brain is getting exhausted. A child who was smart, intelligent, slowly becomes dull, is not able to concentrate. Confusion, anxiety.
Vanishing of
What was something special we spoke in Asarum related to anxiety?
Anxiety from noise.
Anxiety
from noise.
Nice, okay. But there was some
wringing of hand.
Wringing of hand. Okay. So only remedy, wringing of hand during anxiety. Only remedy is Asarum. Okay. Then we saw from an intelligent child how we will go into a confused state, how we will go into dullness, etc., etc. That's what we discussed. Okay. So I'm just trying to have a connection because those 2 classes we have already spent. Okay. And what we are going to do today is next 40 minutes solid, we will try to look at the key points of Asarum. See, typically I will not go from head to toe, okay, because it's a rare remedy, fine. And to be very honest, I have also not got a chance to use Asarum. Or you will understand as we understand the drug picture, why we have not used Asarum. That also is a point that will come up to. Okay. Again, when I told you about the mind of Asarum, what remedies come close?
Carcinosis.
We have carcinosin, we also have borax coming close, and one more remedy that comes close is Naxvomica, which you missed even in the last class. Same where we got stuck. Am I clear? So, thinking about the mind of or the evolution of Asarum, commonly we come across carcinosin, we come across probably borax, keeping that startling and sensitiveness to noise. And many times we would have given Naxvomica. But how is Naxvomica different from Asarum? I thought this question will come from your side. The beauty is you only question and you only answer. How is it different from Naxvomica? Naxal, they also are very ambitious, they want to achieve. Fine, they also go beyond their capacity. But what is that basic thing that we have in Nax and Asarum?
Nax are achievers.
Okay, Nax are achievers.
Zealous, passion.
Okay, what Dr. Swati is trying to tell you is probably in Nax pathology, we don't see them giving up, fine, giving up to the pressure.
They
work very hard, they are very positive people. There is a lot of enthusiasm in them, very hardworking, yes, very ambitious, beautiful. Apart from that, what else you have in Nax that you don't have in Asarum? Can somebody quickly? Irritability. Okay, very good, okay. Irritability, good. There is anger, there is irritability, very good. Apart from that, how do you differentiate Asarum from Naxvomica? Okay, more than pathogenesis. Yes, see, we are looking at the holistic thing. But at the level of mind, how do you separate? How do you differentiate Asarum from Naxvomica? Huh? Okay, Asarum has more energy, Naxvomica has less. Okay, Saraswati says Nax has more energy and Asarum has less energy. Okay, chalo. How do you measure the energy?
They won't be exhausted.
Okay, very good, fine. They don't be exhausted. Good. See, these are all the key points. They won't be exhausted. Fine. They are very ambitious. Chalo, something better. Good. That's a point. I agree.
Thanks.
Yes, Ilan. Huh? Yes. Okay, fine. So, Ilam has a point. What Ilam says is, Nax is born ambitious. So, ambitiousness is what they are born with. And Asarum, they are forced because of parents' pressure. They are into the mode of ambitiousness. Could be valid. Yes, a valid point. What else?
Asarum is more sensitive to
Asarum is
reprimands.
more sensitive. See now, one very important point is, she is talking of sensitivity to reprimands. I am talking to you about sensitiveness to rudeness. They don't like rudeness, which is exactly opposite to Naxvomica. Nax will not bother. You talk to him softly, you talk to him loudly, Nax is not bothered. One author compares Naxvomica to bulldozer. Please don't write all this in your exams. Naxvomica is bulldozer. And many of you are good in drawing. They write bulldozer and then they write Naxvomica. What is it? Picture materia medica. I say when I use certain words, I am using it with care because you are PG students and don't take my words very seriously. But why is that author comparing Naxvomica to bulldozer?
How much your task comes, whatever comes there.
Yes, whatever comes. What is the duty of the bulldozer? It will just keep crush. It will crush. It will not bother. No emotions. Nax is a very cruel constitution. Fine. For example, if it is Asarum, something is behind that bulldozer. Ayo Allah, there is something there. They are very very sensitive people. But Nax will not bother. Nax want the road, the path clear. Whoever is coming in his path, he will eliminate. He will not bother. But Asarum is a very sensitive constitution. Beautiful. One last difference. You gave me two which I did not have. One more very important differentiating factor between Nux and Asarum?
Intellect.
Huh?
Intellect.
Okay, fine, more than intellect. We have spoken so much of mind. We'll have a small deviation. Huh? Okay, yeah, I mean, Nux takes stimulants, good, agreed, beautiful. Yeah, Asarum also good. Chalo, good. Chalo, no, that was not the point I wanted, but anyway, what is it that you have in Nux? See, Nux has sensitiveness to all sense organs. This is what I thought I'll be getting from you. Nux has oversensitiveness to all sense organs. Whereas Asarum has a special affinity for
Auditory.
hearing, the auditory nerve. Am I clear? See, this is a beautiful differentiation. Now if you look back, any person who comes to us with sensitiveness to hearing, we would have blindly given him Nux vomica. Probably that's where we have missed Asarum in our clinics. And this exercise is to make you understand that you have to differentiate step by step. Many Asarum cases we would have given Nux vomica and we would have lost the case. They would have gone to some other doctor. I did not feel better. Okay, fine. So Asarum has sensitiveness mainly of the hearing faculty, whereas Nux vomica has sensitiveness of the entire sensory organs, sense organs. Okay. Now how is it different from carcinosin? How is it different from Carc?
Carcinosin is creative.
Carcinosin is more artistic. See, carcinosin also is in the same boat. He is also forced. You have to study, you have to do like this, do that, blah, blah, blah. If I am somebody and if my son is carcinosin, I want to make him a doctor because I did not become a doctor, then I make sure he becomes a doctor. Fine? We force upon so much. And Carc, from what I have learned from Vijaykrishna, Carc is somebody who gets
molded.
To any situation they get molded. Okay? After listening to sir, I have used Carc in clinic more often because I had a better understanding after listening to sir. So carcinosin, again sensitive to rudeness. The sensitive part of Asarum you have, but Carc gets molded very easily. And Carc is more intelligent. Carc is more artistic. Fine? Carc is more creative. And carcinosin does not have sensitivity at the physical level. This is how you have to stepwise differentiate remedies. If you continue doing the same, then we will not start with this. But it is very important because you are not UG students. You are PG students who are prescribing or you start prescribing shortly. So you should know when Carc comes, when Nux comes, when Asarum comes, which one to pick up, how to pick up. That's a very important exercise. Okay? I am happy that we had a very good interaction. And that's the beauty of GHMC classes. We'll get back. See, now what I am trying to tell you is, next 40 minutes, we are just focusing on the key particular symptoms of Asarum. Okay? Fine? Key particular symptoms of Asarum. So, though I will be starting from head, I will not tell you everything under head. Okay? We will try to pick up only those things which I have seen in the material books, and the same thing I have also seen in the repertory. Only those confirmatory things I am trying to give it to you. Okay? And you can always go back and refer Asarum. This is not end of Asarum. This is only an introduction to Asarum, so that you can go back and start preparing. See, now from what you see here, Asarum, like many of our remedies, they have headache. We once had a material teacher, The teacher would tell, every remedy has headache. Correct, no? If you see any remedy from aconite to zincum, there is headache. But you also have to understand, or you have to go in the depth and realize how aconite headache is different from zincum headache. Okay? So Asarum has a headache. In the process, or when they have the headache, the head becomes tensed. In the process, the scalp becomes very, very sensitive. I'll repeat this. What is it? Headache, wherein the head becomes tensed, the scalp becomes again very sensitive. Okay, there is pressure in the head, there is tension in the head, the result of which is the scalp will become sensitive. Okay, now this is when our Asarum people will have, they can't comb their hair. Okay, are you getting this point? So they can't comb their hair. Why they can't comb their hair?
Sensitive.
Because what is sensitive hair?
Scalp.
Scalp. Can I have some quick interaction here? What other remedies come to your mind? What is the rubric here? Combing. Combing, no. Okay, good. So what remedies come to your mind as a small interaction? Is the question clear? When you take more than 30 seconds, I start doubting myself. What is the doubt I have? Did I frame the question correctly? Doubting myself and overconfident about you people. Okay. Meenu had a straight point. She is talking of bryonia. Beautiful. Sina. Good. Okay. Please keep the remedies in your mind and we'll get back. Meenu, why bryonia? What is it that you have in bryonia? Okay. Combing? Very good. Can somebody quickly tell me why there is combing aggravation in bryonia?
Movement.
Okay, for example, when a bryonia patient has a headache, okay, he, mother, wife, sister, somebody in India, we see, everybody will have that authority to comb. So when somebody is trying to comb, okay, so in bryonia, that slightest movement can aggravate. So combing aggravation is bryonia. Okay. Now, Dr. Venkatadre, what is it you wanted to tell? Why Sina?
I don't know the reason, sir, but mostly in females.
Okay.
They don't like to comb that and they want to get down.
Okay, fine. So, okay. See, Sina, they want their hair to be let down. Okay. See now, why they want their hair to be let down is a point. Now, why is it so? Sina is again, as you know, that they are very irritated constitution. What is it that you have in Sina? Touch, look, everything aggravates. Okay. So probably that sensitiveness. Here it is movement. In Sina, it could be more of sensitivity. Fine. And the nerves in Sina, they are hyper, probably like Asarum. So sensitivity. That is what you have in Sina. Now talking about the point sensitivity, can you think of any other remedies?
Chamomilla.
Chamomilla, fine. Okay, see chamomilla again, very angry constitution, sensitive, good. But sensitive, that they will not allow their hair to be touched. Sensitive, they will not allow their hair to be brushed or combed. Which is the remedy? What is the keyword I am using here repeatedly? Sensitive. Which is the remedy that should come to mind? Hephar. Hephar again will not allow to comb out of sensitivity. Bryonia will not allow to comb because that movement, see the beauty in bryonia, that movement will aggravate. Okay, fine. Hair cannot be combed. There is a rubric in your repertory. What is it? Hair cannot be combed. Which is the remedy? Very good, borax. What is that word that should come to your mind? Plica, polonica. Now you tell me the remedies.
Vinca.
You have vinca, you have borax, you have meserium. Beautiful. Okay? You have meserium. Okay, I mean, see now the list goes on. At least what I am trying to tell you is, I want you to understand. Hair cannot be combed. Fine? Is all those remedies. Combing aggravation is a different set of remedy. And
Sensitive.
does not comb, there is a rubric. You are getting it?
Yeah.
See, here is not sensitive. Here there is no plica polonica, but the child will not comb. So here does not comb is sulfur. Here combing aggravation is a different remedy. And on combing hair there is hair loss. Why you don't comb hair? Because, sir, if I comb hair there is hair loss. Which is the remedy? Hair loss on combing hair. Huh? One remedy. It's not selenium. It is not thallium. Sorry, I don't know much about thallium, but it is not thallium. Okay. The remedy is cantharis. Many hair oil, you have cantharis as a content. Okay. So, here because the head is tensed, the scalp is tensed, fine. they will not allow, or they will not comb themselves, or they will not allow others to comb. And this is what I was trying to tell you. Hair cannot be combed. Is borax, is your vinca and other remedies. Okay? Mesothelium and other remedies. See, hair not combed, that is sulfur. Okay? And combing aggravation is candles. Now why they don't comb? Because when they comb their hair, the hair starts falling. So, yeah, combing aggravation is more of Bryonia. Hair falling, combing on is Cantharis. Under combing aggravation, you also have Sina, you also have China, Cinchona. You can also think of Hephar and other remedies. Okay? See, apart from headache, what you also have in Asarum is vertigo. Okay? Vertigo, they feel as if they are floating in air. Vertigo, as if they are floating in air. Okay? Any other remedies? Floating in air. Which
Phosphoric
is
acid.
Valeriana.
more than valeriana.
Lactonic.
Laccan. Good, very good. Laccan. Laccan has that floating sensation. Laccan, beautiful remedy. Okay? Laccan must be given some time, but Rashpati has taken a beautiful case. We'll discuss when time permits, but for time being. Okay? Laccan also has that floating sensation. So, three things I want you to remember in Asarum. Headache, that scalp getting tense, and the other things. See, moving ahead, the other part that we have here is eye of Asarum. Okay? Now, any wild guess what could be the probable symptom related to eye in Asarum?
Neuralgia.
Huh?
Neuralgia.
Okay, neuralgia, could be neuralgia, we'll take that. Or we'll see if there is neuralgia. Good, simple and safe, conjunctivitis. Okay, see, in Asarum you got a lot of inflammatory conditions. Okay, conjunctivitis, blepharitis, chronic inflammatory conditions related to eye. More than that, what is very, very important for you is, what is it? There is some problem with this left eye. So we assume the problem is pain, shooting pain, okay, or darting pain in the eye after operation. Should I repeat? What is it? Shooting pain, sharp pains in the eye. Which eye?
Left eye.
The eye which has been operated. It could be left, it could be right. But what is the condition? It should be operated. Okay. Now, as a PG student, do you want some remedies? Do you want some comparison here? Which are all the other remedies?
Allium cepa.
Okay, Allium cepa has bad effects of operations.
After amputation.
After amputation, yes, good.
Staphylococcus aureus.
Staphylococcus aureus, very good. Yes, what happens in Staphylococcus aureus? Huh? Staph is a good thing. Dr. Sunil is contributing. Staphylococcus aureus. What is it that you have in Staphylococcus aureus? Staphylococcus aureus again has all those incised, clean-cut wounds. Ailments after surgery. Staphylococcus aureus. Now, what will happen in eye? In staph?
Styles.
After surgery? No. See, Staphylococcus aureus is a good remedy for eye. I don't deny. But my question is, what will happen in Staphylococcus aureus after eye operation? What happens in Asarum?
Neuralgia. Pain.
Shooting, sharp shooting pains. Okay? Or if you see the mind of Asarum, hysteria. What is it? Hysteria after eye operation. The only remedy you have in your material medical. Hysteria after eye operation. Only remedy is Asarum. The lady will act, or the gentleman will become hysterical after eye operation of in that particular patient. That is Asarum. Now, what will happen in Staphylococcus aureus? You should know. So, in Staphylococcus aureus, after a cataract surgery, there can be prolapse of the iris. Only remedy. See, these are all, we don't get a chance to verify, because many times patients, they don't come to us or even if they come to us, we are not confident. Okay? But remember, prolapse of iris after cataract surgery, the remedy is stephysagria. If it is photophobia after eye operation, which is the remedy? Photophobia after eye operation. Is a rare remedy. More rare remedy. Must be will have different set of remedies coming up. I know physostigma is a rare remedy. See, rare remedy depends upon the person who is using. For many, arsenic can be a rare remedy. For many, Naxomica can be a rare remedy. So conditions apply. Fine. So the remedy here is photophobia after eye surgery is strophanthus. And what do we know about strophanthus?
Heart affection.
It's a very good hot tonic. But also remember, strophanthus has photophobia after eye operations. So we'll go ahead. Probably this is what I wanted to tell you. We have covered all this. Stitching pains or stitching which remains long after operation. The only remedy is Asarum.
Asarum.
Though it is a rare remedy, many symptoms we have in Asarum which is only there in Asarum. Okay? So other remedies we just discussed. It could be stephysagria, it could be strophanthus. One more remedy I wanted to include here is meserium. Any wild guess what happens in meserium after eye surgery? Ciliary neuralgia. Ciliary neuralgia after eye surgery. One author says, for some reason if the eyeball is removed, some reason, some tumor, something like that, post-operation, they come to you with ciliary neuralgia. The only remedy will be meserium. See, these are few remedies that you should nothing. You should know in stuff. Okay? You should know in certain remedies. Meserium is a remedy which has post what operative neuralgias, especially ciliary neuralgias. Okay? I forgot to mention, but you should remember. See, similarly, we can discuss many remedies here after surgery. But then the only headache here is we can't finish Asarum. For example, after any nasal surgeries, if there is epistaxis, which is the remedy? Some nasal surgeries happened, and after that there is no stoppage in the bleeding. The nose continues to bleed. After a nasal procedure, okay, which is the remedy? It's not totalis. It is thalapse bursa. So from head to toe, if you go now, there are so many things. Bismuth, stephysagria, ferrum, lot of remedies. But you should know when and where. Okay? Firstly, some other day we will discuss. Today, our focus is Asarum. We will try to finish Asarum. Two small areas we discussed. One, head. Head, what did we discuss? Headache. And what was the specialty here?
Combing.
Combing. They can't comb the hair. And we also saw vertigo. They feel as if they are floating in air. Second thing we saw was eye. We saw a few things here under eyes. What was it? Post-operative complaints.
Shooting, darting.
To the extent that they can go to hysteria, or stitching pain remains long, or burning, or the sharp pains. Okay. Now we are talking of a very important thing. This is the only thing that we were aware of Asarum. Unless we went deep inside and we started digging, what else we have in Asarum? Now what do we have in Asarum? Oversensitiveness to noise. Okay. See, there is so much of overstimulation of the auditory nerve. As a secondary effect, they will go into
deafness.
This is also a very important statement. First thing what you see is there is sensitiveness to noise, and over a period of time, what we saw in the mind also, mind is getting overstimulated. Even here the auditory nerve is getting overstimulated, and then they go into deafness. So if a man who comes to you with deafness, if you just go back and the wife will be telling, sir, before he was so sensitive, small thing falling somewhere, he would close his ears. Now we are putting what something big goes in front of you, nothing is happening. If at all you get such situation, the remedy will be Asarum. Asarum. So that will be about Asarum. And here there is something very interesting I found when I was digging deep into Asarum. Here what you see is the taste gets altered. Now when is the taste getting altered in Asarum? When is smoking. When is smoking, tobacco will taste bitter. See, I am not talking of anything else in mouth. I am focusing on this symptom. Tobacco tastes bitter when smoking. So that taste is getting altered. And I was also cross-checking in the repertory. In repertory you have few remedies. Chena, camphor, propolis, euphrasia, spongia, and of course Asarum. Okay. So this is with okay. Now we were talking of mouth, and then I am talking to you about the stomach of Asarum. Stomach. Now stomach, the text has already come, but what I want you to remember in Asarum is there is a kind of a sensation. Okay. And if you could read that, see, horrible feeling at the epigastrium on waking in the morning. So who is having this horrible feeling in the epigastrium? Mainly people who are drunk. In Asarum. Okay. So if you just, again I was referring, in the mind there is a rubric, anxiety in stomach in morning on waking. Okay. See the rubric in the mind, chapter anxiety. In the mind you have a rubric anxiety there. In stomach in the morning on waking. Only remedy is Asarum. And when I was again trying to understand Asarum, this is what happens in a person who is alcoholic. So this is one area that we have missed in Asarum. What is that area that we have missed? Asarum is a very good remedy for alcoholism. Okay. Again, if you see your repertory, to remove the craving for alcohol, Asarum is given. Okay. Now shall we take a few remedies for alcoholism and the indications? What will happen in those remedies for alcoholism? Should we take it up or should we proceed with Asarum? Beka bedwa? You beku andre heltini, beda andre heltini, because it's important. Fine. See, what I am trying to do is what I am learning new or what I know, I am just sharing. Fine. With the intention that somebody might get a chance in future to prescribe a remedy. Okay. Now when we talk of alcoholism, what remedies come to us?
Quercus.
Quercus.
Strophanthus.
Sulfuric acid, yes.
Naxomica.
Naxomica.
Syphilinum.
Selenium. Syphilinum. If you have told selenium, it is also there. Okay. Only 5? Strophanthus. Quercus. See, don't repeat again. The cycle is repeating because I said 5. If it repeats, the number will not increase. Okay, folic acid, good. Ranunculus bulbosa, beautiful, good. A rare remedy. You have not explored. Yes. So now the task next will be when ranunculus bulbosa, when fluoric acid, when quercus, or when naxomica. So this is very important. Now what will a ranunculus bulbosa patient who is an alcoholic present to you with? Or what is the indication of ranunculus bulbosa in a patient who is alcoholic? Okay. See, to be very frank and honest, I don't have too many patients that I have treated for alcoholism. The word alcoholism itself says, what does it tell? That it's a disease. See, alcoholism is there under mind.
Mania. Dipsomania.
Dipsomania. Meaning, see, you are so much into alcohol that you can't come back. Fine? And 99% of the patients that I get, are the family members. Sir, my husband drinks alcohol. Please give something so that I can mix it in milk, mix it in water, and if he drinks that, you should start vomiting or you should start nauseating. So unfortunately, I can't do this. I don't know about others, and I bluntly refuse such cases because there is zero motivation from the patient side, and you are giving it, and I don't know, seriously, at least I have not experimented this part, so I can't comment. But if somebody comes to me telling, sir, I want to get rid of this, yes, then I feel some kind of a motivation. Patient is motivated, I am motivated, and then we can think of. Very few cases I have. One case is a case that I treated with pulsatilla. He is very fine, absolutely fine. And in him, why I gave him pulsatilla, I don't remember the exact case. It was long back. But this man would quit alcohol and again start alcohol. Quit alcohol, start alcohol. Quit, start, quit, start, quit, start. This is when I had attended Sir's seminar in Mumbai. And Sir was talking of a rubric. And that rubric was clinging. I don't know how many of you agree with this, but please have open mind. Don't be too narrow-minded. We will not grow if we are too narrow-minded. So there, broadly I had applied this as clinging. You understand? ಒಂದು ವಾರ ಬಿಡ್ತಾನೆ ಮತ್ತೆ ಒಂದು ವಾರ ವಾಪಸ್ ಹೋಗ್ತಾನೆ. So ಬಿಡೋದು ಹೋಗೋದು. So he's not able to let go alcohol completely. And he had come to me seeking help. Sir, please do something. I want to let go. I am not able to let go. Fine. So there I had taken clinging. And something else we had taken, and pulsatilla 50 ml was given to it. And it's almost 3 years. Okay. One of the homeopath referred. You know, this gentleman is doing beautifully well. He is probably somewhere in Dubai or somewhere, got promotions, and he is very, very happy. Right? So that's one or two cases I have. Quirkus I have used bottles. How many bottles? 450 ml bottles I have used. When the wife comes and tells, no, please give something. So I have given Quirkus, they have given in alcohol, Quirkus, and the man had Quirkus and he continues to have alcohol. So I have stopped using Quirkus. This is my experience. You might have better experience. I am talking from my side, and I limit to me only. Fine. So Quirkus I have got bad experience or no experience, so I don't give Quirkus. But it's very important you realize and understand when a remedy has to be given. The topmost remedy that comes to our mind when we talk of alcoholism is Naxwamika. Okay. So what will happen in Naxwamika? You all know why Naxwamika goes into alcoholism. Dr. Sunil was talking a few minutes earlier. There is a journey in Naxwamika. See, each of the alcoholic person, they will have their own story. The first thing is you need to understand why this person went into alcoholism. That's a beautiful story. And any movies you see, they have a story. Sir, I am not born drunkard. I did not, I did not come out with a bottle in my hand. But circumstances made me become an alcoholic. Boss, what are those circumstances? And each of them might have their own stories. Their stories may help you arrive at a remedy. So when you are looking at an alcoholic now, please try to understand why he became alcoholic. That's your first step. 99%, they want to be in a different world. घर गया तो बीवी के साथ पंगा, when office गया तो boss के साथ पंगा, and they want to forget everything and they want to be in their own world. And alcohol will take them to a different world. So they are into alcoholism. Each of them have their own reasons. Disappointment in love, common reason given by the young group. Or what? Familiar pressure, or business loss, or like for example peer pressure. My friends drink, so I drink for social status. Sir, some meetings I attend, I have to drink, sir. That's how I started. And today, he is drinking so much. Fine. So each of them will have a story. Try to understand the story, and from there you can enter, and there you can start prescribing. Okay. So nuts, as we all know, and in Russia, from Alensky note I have taken the statement. In Russia, it is a popular remedy which was used way back to treat alcoholic patients. Okay. See, unconquerable desire for alcohol. In Asarum, there is so much desire. Fine. Okay. So much craving for alcohol. So the dipsomania part. See now, this is very important. Alcoholism. So the remedies, quickly we have Naxwamika. See, Naxwamika has few things. Why they get into alcoholism is that
Ambition.
stimulus, one thing, or alcoholism from idleness. There's a rubric in a repertory. Alcoholism from idleness. What is it?
Jobless.
You are jobless, you are lazy, you have got nothing to do, and then you start alcohol. That is also there in Naxwamika. Naxwamika, lacusis and sulfur. 3 remedies, you should remember. So, alcoholism with irritability, alcoholism with dim vision, okay, and alcoholism with epistaxis, some problem. No? Alcoholism with acne, alcoholism with gastric affections, indigestion, piles, you can think of Naxwamika. Okay, next is one top remedy we all know. Now, somebody has talked of selenium. The only remedy which has desire for alcohol before menses. Naxwamika also has desire for alcohol during pregnancy or after delivery. Again, only remedy. If a lady says, in pregnancy I have developed a craving for alcohol, or post delivery, if she somehow starts getting into this habit of alcoholism, the remedy is Naxwamika. Okay? So selenium, China, top remedy. Again here it is recurrent alcoholism. Fine? And abscess in lungs in an alcoholic person, the only remedy is China. These are all there in repertory. I have just taken time and I have just compiled it for you so that as a PG student you get a little more. Agaricus, when there is discoloration, tip of the nose, and when there is headache, in alcoholics you can think of agaricus. Similarly, Crotalus, is a very good remedy for
Alcoholic liver disease.
alcoholic liver disease. CHD, correct? No? CLD, sorry.
ALD.
ALD, yeah? Chronic liver disease.
Yeah.
Okay. Alcoholic ALD, correct. ALD. Alcoholic liver disease. So, pulmonary edema, varicose veins in alcoholics. The only remedy is Crotalus. See, these are all pointers. People who believe in short prescriptions, or when you are looking at these things, pulmonary edema and is an alcoholic, from the repertory you have Crotalus. Though I don't prescribe like that, but there's nothing wrong in having the knowledge. Okay? Varicose veins, and somebody has talked of ranunculus bulbosa. Okay? So now what ranunculus bulbosa has? When an alcoholic will have hiccups, or when an alcoholic will have eructations, we have only 2 remedies in our repertory. One is, at least tell ranunculus, it's all right there. And the other one is sulfuric acid. Only 2 remedies. And weakness of lower limbs. An alcoholic who has weakness of lower limbs, then the only remedy is ranunculus bulbosa. Okay? So, sulfuric acid again. In sulfuric acid must be from the materia. What is it that we have learnt? Correct, Shweta, what is it? Correct. Even water should be mixed with alcohol. I was watching this movie yesterday in Amazon. Somebody has watched that movie? Yemayindi Lokampo, I don't know the title exactly, but there's a movie I was just watching. I will give you the title. He again will have, you remember the title. He again will have a love failure, and then he will go into alcoholism. I don't know, I thought at least you'll watch movies. I thought you will tell me the title, and I thought I'll focus on the material part. But there again, that guy, his friend will offer him tea, and he will not drink tea. Then the other friend will comment, if I pour alcohol in tea, will you drink? So much he will be addicted to alcohol. He will lock himself in room. Only nights he will go where? Go to the shop, buy alcohol, stock it up, and whole day is drinking in the room. So alcoholism, which started from disappointment in love. Sulfuric acid, as Shweta rightly pointed out, even water should have, if they have to drink water, there should be little alcohol in that. Otherwise, sulfuric acid will not take alcohol. Okay. Now, skin ulcers in an alcoholic person, the only remedy is sulfuric acid. Now, see, there's another remedy that I was going through. Medevinum, drinking on this slide. How do you interpret this?
Deceitfully.
Huh? Yeah, they
Without,
are drinking
Secretively.
secretively. See, medevinum is drinking in a secretive way. Many times we put, please don't include me, but they put alcohol in Coca-Cola bottle. Correct? I had a friend, in train alcohol is not permitted. Okay? This way back. So he used to pour it in a Sprite bottle, depending upon the color. Or if it is a brownish, then you would put it into the Pepsi can, Pepsi bottle, and he would drink. This is not out of sly. This is because he can't even forego that night journey. He had to drink. In medevinum, they will be drinking in a very secretive way, in a very manipulative way. Nobody will get to know. My son, no. Fine. My child, no. That's the kind of image you would have managed. See, again, I was reading medevinum. There's a beautiful thing in medevinum. Many times, why many of us, many of the people drink is because they say, you want to tell, many movies you would have seen, no? You want to propose to a girl. Then what will the friend tell? This guy is not having courage to propose. So what will the friend tell? Hey, 30 body. And I was seeing a movie recently, and then again, she drinks 30. And she'll not, no, I am not feeling courage. Then he says, take another 30, till you get courage. And then she'll go and tell some movie. Must be Manmatra or something. So what I was trying to tell you is this Nagarjuna and one more movie. So what I was trying to tell you is, medevinum will drink out of timidity. There's a rubric. Alcoholism out of timidity. Somebody says, drinking alcohol will give you courage. Then, he's a timid guy, and then he'll start drinking alcohol. Fine? And probably you will also drink alcohol in a very cheating way because he is timid. We can also link it either ways. And diabetes associated with alcoholism. Only remedy given in your repertory is medevinum. Clear? We'll go ahead? Okay. So these were few symptoms, few remedies that I wanted to discuss. There are plenty more. Okay? But I wanted to give you an idea how you have to study so that you know what is important. We'll quickly go through Asarum. What you also have in Asarum is it's a very good remedy for morning sickness. Very good remedy for morning sickness. Now, again looking at your materia medica, we many times miss Asarum because Asarum has morning sickness, bad retching, bad nausea with clean tongue. So what is it that we are missing here? Or what is it Asarum missed for?
Ipecac.
We give Ipecac. You are getting my point. Tomorrow, how will you not miss Asarum? What is that confirmatory point in Asarum? What is that confirmatory point? The sensitiveness to noise. So if a lady has nausea, morning sickness, she has got retching, she has got a clean tongue, before prescribing Ipecac, what is that one question you need to ask?
Noise.
Are you feeling sensitive to noise? If she is feeling sensitive to noise, at least from today's class we have understood, then it is not Ipecac, then it is Asarum. So this is how we also start practically using Asarum. See, all these days we were not aware of Asarum having all these symptoms. So blindly we would prescribe Ipecac or some other remedy. If it is associated with that sensitiveness to noise, the remedy should be Asarum. That's what I want to highlight there. Now retching, loathing of food with clean tongue. Asarum under generalities, when I was looking into the chapter of generalities, you will find lot of PQRS desires and aversions in Asarum. Okay? Now what is the desire in Asarum?
Alcohol.
Very good. One is alcohol, you already know. The other very important thing is they have desire for fruits. Okay? The third very important thing, very few remedies have, and what is that desire Asarum has is desire for nuts. What are those nuts? Generally,
Dry
we
fruit.
talk of peanuts, badam, almond,
Cashew.
cashew. These nuts, no. So they are desired for nuts. Very few set of remedies has desire for nuts. 8 remedies. Okay. In that Asarum is one. So it is very important. Okay. So desires, alcohol, milk, nuts in brackets. I have given you few more remedies which has desire for
Nut.
nuts. Calcarea, sepia, symphytum. Now what are the aversions? Again some PQRS aversions. Aversion onion. Aversion garlic. Can I have a list of remedies? Remedies having aversion to onion
Tuja.
and garlic. Good. One is tuja. 2 more remedies. And both remedies are common. Meaning
Lycopodium.
they have desires, they have aversion to garlic and
Desire.
onion. Tuja is one remedy. 2 more remedies. 2 more remedies having aversion to onion and garlic. The 2 other remedies, prominent remedies are phosphorus and sabadilla. What is it?
First.
Phosphorus and sabadilla. Okay. You can also add asarum. Onion, garlic, fish and fat. These are the dislike or aversions you have in asarum. See now the last part here will be the female. Okay. Now what do you have related to female? Can somebody quickly interpret? Dysmenorrhea. Okay, they have dysmenorrhea, bad pain in back. Pain in back, aggravation, movement. To the extent even that breathing will cause pain. It comes very close to bryonia. Fine. In bryonia it is told slightest movement. In Asarum, the pain to the extent even breathing, they have pain in the back. Asarum. Okay, one. The second very important thing I was again referring, and what I have come across in the female genitalia is it's a very good remedy for threatened abortion. What is it? Threatened abortion. Now, what is that is triggering this situation in Asarum? See, Asarum basically you saw the mind, they are very
Anxious.
sensitive, very emotional, very nervous constitution. Okay? So, threatened abortion from excessive sensitivity of nerves. Nerves are in a very sensitive state, and even imagining something unpleasant will cause a thrill which will pass through her. See, first thing understand threatened abortion. In threatened abortion, what will happen? There is only a threat. Not that she will abort. 99% they will continue to deliver a healthy baby. So here, any small thing they think of, something rude is happened somewhere, some violent is happened somewhere. She is thinking of that violent thing happening somewhere, and that can disturb or that can threaten that she might go into an abortion. Are you clear with this statement? It's not there in repertory, but it's given in a few material books. So I thought you should know as a PG student. There are various remedies for abortions. Okay, and where you think of Asarum is very very important. Any further explanation required, or is it clear? Sensitive women, emotional women, okay, and who even listening to anything unpleasant can pose the threat of aborting. Okay? And there can also be leukorrhea. Even in GI there can be dysentery, there can be diarrhea, and the discharges in Asarum will be generally very slimy and yellowish. That kind of discharges you have in Asarum. Okay. So going ahead, this is the last part of Asarum, the aggravating factors. In general, what aggravates in Asarum? Emotions. See, emotions will bring in chill symptoms. Chills. Any emotional thing can bring in chills in the body. So if we can again relate this to the threatened abortion, they are very sensitive people. That is what is the highlight. Okay. So Now, one very important ameliorating factor you have in Asarum is damp wet weather. And when I was confirming this in repertory, under generalities, weather, damp, weather ameliorates, you have only two remedies given in 3 marks. One is Asarum and the other one is pulsatilla. Wet weather ameliorates. Wet weather, damp wet weather ameliorates. Okay. Now the last interactive part will be this. Now this will sum up the entire exercise of understanding Asarum. I've been insisting anything that we study should have a purpose. Okay. Now what is the purpose of studying Asarum? Is you have to apply it in your clinic in future or whenever you get a case. Now to sum up, what will be the clinical utility of Asarum? From your medicine knowledge, from your psychology knowledge, Gynec, OBG, whatever it is. In which conditions can you think of Asarum? This is my question. Last question. Last component of today's class. And this component will sum up the entire thing, what you have understood in Asarum. Okay? So, what would be the probable clinical indications of Asarum?
Alcoholism.
One at a time. Yes. Very good. Morning sickness. And in morning sickness, what was the indications?
Clean tongue.
Any case of morning sickness, you can't give Asarum.
With the noise,
Correct, Allah.
sensitivity noise.
See, and that's what I wanted to conclude in the end. Any damn thing you tell me. But what will be the ruling point? In Asarum, there should be sensitiveness to noise. If there is no sensitiveness to noise, then Asarum will not be indicated. Though we have spent 3 hours, no sensitive to noise, no Asarum. This is the take-home message. So morning sickness, any other conditions that you can think of? Huh? Meniere's disease. Okay, Meniere's disease, fine. Vertigo or they having those noises. Any other thing?
Alcoholism.
Alcoholism itself. Okay. You can think of this in dysentery, diarrhea, dysmenorrhea, abortions, threatened abortions. Okay. And we also saw a little higher up, you saw that inflammation of eye, post-operative conditions, shooting pains, hysteria, mind thought we spoke so much. Okay. Sleeplessness from noise. So insomnia can also be part of Asarum. Okay. So to conclude here, I got a list. The list can be bigger. This is what I have made from my side. It can be a bigger list. I have gone from head to toe so that you don't miss anything except for a few things here. So headache, inflammation of eyes, post-operative affections, hearing problem, deafness, the distortion of taste which comes out while smoking. Gastritis, morning sickness, alcoholism, threatened abortion, dysmenorrhea, leukorrhea, dysmenorrhea is here, dysentery, diarrhea, insomnia, all those things we can add it in Asarum. Okay. Now before I close, any questions in Asarum? If you have anything to ask, feel free to ask. If you have nothing to ask, then don't force yourself or trouble yourself in asking. Anything? Is it clear, Asarum? Fine. But what we already know is what should be there. So that is the tragedy. Without what we already know about Asarum, Asarum cannot be prescribed. And what is that symptom? We already know about Asarum. That is oversensitiveness to noise. If that is not there, it is not Asarum. It could be anything. Okay, it could be anything. I have referred a lot of books. If you want, I can share a case from GB's, Viva. Okay. So, elaborately described, and majority of the things that I have taken is from his book. Though I have also referred Fataks, Bori, Carc, and of course the synthesis and complete repertoire. I have referred and I have taken. So, GB talks of a case of hypertension. 220, 130, something like that. big reading, very scary reading, but he prescribes Asarum based on the condition that he was having bad sensitiveness to noise.
Noise.
So though it was not mentioned anywhere, under hypertension you don't have Asarum there, but he prescribes Asarum because of that sensitiveness to noise. So without sensitiveness to noise, Asarum will not be indicated. That is the take-home message. So in terms of references, I already told nice books that I have referred, and of course Google Images, from there I have taken a lot of images. Right? So we'll close, or anything you would like to add, contribute, ask? Nothing? Chalo, thank you, and hopefully next class we'll start with another rare and